I'm Jen Taylor Skinner, and this is the Electorette. California is facing massive healthcare cuts driven by federal policy. Cuts that are already raising premiums, costing jobs, and threatening access to care for millions of people. Now, voters may be asked to decide on something unprecedented: the first ever statewide billionaire wealth tax to protect California's healthcare system. In this episode, I'm joined by Suzanne Jimenez, Chief of Staff at SEIU, United Healthcare Workers West. And she breaks down how this ballot measure would work, who it would affect, and why healthcare workers are leading the charge. We also talk about what happens if it doesn't pass, and what's truly at stake for Californians. So, without further ado, here is my conversation with Suzanne Jimenez. Suzanne Jimenez, thank you for joining me.
Oh, thank you for having me. Excited to be here.
So I want to talk to you about the budget reconciliation bill that was signed into law last year. It was colloquially referred to as the Big Beautiful Bill Act, or the Big Ugly Bill, some people like to refer to it as. And this bill included a couple of notable things that I want to dig into today with you. And the first is it included these historically generous tax cuts for the wealthiest Americans. And it also included massive healthcare cuts for everybody else. So can you give me a summary of what we can expect from those healthcare cuts?
Yeah. So HR 1, I don't use that title that the president uses, but HR 1 created massive cuts. So over $1 trillion in healthcare cuts across the country, which is the largest cuts in healthcare in history. But specifically in California, as we started to break down the numbers to really understand what that looked like, it's about anywhere between $20 to $30 billion a year. For the next several years, honestly, it's like the big cuts are in the first 5 years. And so in the next 5 years in California, we're expecting at least $100 billion in cuts to healthcare. And so that's cuts to Medi-Cal service, or Medi-Cal is our Medicaid program here in California. So cuts to Medicaid, which is, nursing home services for seniors, healthcare services for about a third of our kids in California. It's just very devastating and massive when we just look at what services will be cut here.
And I'm glad we're having this conversation now, because this bill was all over the news last summer. And so much has happened since. The news cycle is so chaotic that the harm that this bill is going to cause to working families, to children, to poor people, to older people, it's been buried, frankly. And I think that's partly due to the fact that we do have this chaotic news cycle, but also the fact that I think a lot of these cuts won't take effect till the end of this year, and some go into effect in 2028. Do you know the timeline of those healthcare cuts?
Yeah, so we start seeing cuts this year, but the biggest cuts start really in next calendar year. But I think what we're starting to see now in California, and honestly, this is happening across the country, not just in California, but what we're starting to see is that premiums are going up, healthcare premiums. And so we're starting to see businesses having to shoulder those cuts because insurance companies are now expecting these cuts to go to them too. We're starting to see hospitals who are concerned about being able to pay for healthcare workers or pay for jobs. They're starting to cut workers. And so just recently, in the last month and a half, 2 hospitals in California have cut jobs, and they are saying it's directly due to HR 1 cuts. And so it just, we are going to start, even though the major cuts start in next calendar year, we're starting to see the effects now. And I think as you cut $20 to $30 billion from your healthcare system, we are going to see hospitals close. We are going to see ER close. We're going to see our community clinics that serve the most vulnerable folks in our state not be able to survive. Right. Plus all the other attacks that are happening on them. So I just think that there is a lot happening right now in the news cycle, but it feels like folks have forgot what HR 1, what those impacts are going to look like. And so part of, honestly, this campaign is reminding folks what it's doing, because we forget sometimes, right? If you're not following it, if you're not in it, you don't realize it until you're the person that needs to go to an ER or to a hospital to get services.
Right. I agree with you. But, the tax cuts for the wealthy, I bet those kick in right away.
Yeah. In terms of what they're going to, yes, absolutely. I'm sure they're already raking it in, which is the unfortunate thing, because it's on the backs of everyone, not just in California, but throughout the country.
Right. So California has proposed the solution, and the state is advancing this ballot measure, right? A tax on billionaires to make up for this shortfall. Can you tell me about the details of this ballot measure?
Yeah. So this is actually a quite simple ballot measure. It is a one-time emergency 5% tax on the wealthiest people in the state, so billionaires. So anyone with a net worth of over $1 billion would be responsible for paying that. That's just over 200 people in the state of California. They would pay 5% of their worldwide net worth. They could pay it in one payment. They could pay it over 5 years, 1% a year. And what it would generate is just over $100 billion in funds for the state of California. And the way that the initiative is drafted is 90% of it would go to healthcare. So specifically to cuts that were driven by HR1. And then 10% of it is going to go to K through 14 education and food, emergency food assistance, so food stamps. So it's quite simple, actually. The initiative itself, just over 200 people would be taxed. And what it's going to do is really bolster the healthcare system and make sure we don't have a collapse of our healthcare system here in California.
That's actually quite generous. It's a one-time tax.
Yes.
And think about what you gain from that. So, if you're feeling empathic towards billionaires, they're going to be okay. It's not
I
like
mean, they're going to be more than okay. And one of the things that I've been sharing with folks is, say they take let's do a payment 1% every year. They're going to make that money in less than 2 to 3 months because their wealth just multiplies day after day. So this is really very modest for them. I'm probably, whatever a word is below modest, like they can totally afford this, but they're also going to make it up very quickly.
Yeah. And I just want to focus in on something that you said, because I actually didn't know this. So first of all, let me just throw this stat out for people.
Yeah.
California has the highest number of billionaires in any state in the
Mhm.
country. And I thought it was around 185 billionaires. And I think that data was from 2025, but it's 200, which is nice for you
Yeah.
guys.
Well, and honestly, there's other newspapers that are reporting more, up to 250. But what we have and what we've been able to verify, it's about 204 billionaires. That's a lot of billionaires. And with just this tax, just from those 204 people, we can generate $100 billion, save our healthcare system. We'll give some assistance to schools and for food assistance, and one-time tax. Like, it's just,
One
again,
time.
such a simple, easy initiative, but yeah.
One time,
Lots of
right? And
push.
you think about that, just put that into further context, right? These are billionaires. We're not even talking about multimillionaires.
No.
These are billionaires. Imagine how much wealth there is if we kind of made things more equal across with these wealth disparities. And that's another thing about California. And California typically ranks near the top in terms of income inequality and wealth disparity, right? Which of
Mhm.
course shows up in a person's healthcare.
Yeah, absolutely. And when we designed this initiative, we were really just trying to solve this problem. What are we going to do when all of this money is cut from our healthcare system? Like, just the devastating consequences of that alone, we are going to see a collapse. And to be able to, we're working with some of the smartest people, they're tax experts and economic experts that, they were able to devise something so simple, and only 200 people have to pay it. And that will save the healthcare system for everyone, including them, including the billionaires that use our hospitals, right? So, yeah.
Right, because you're keeping emergency rooms running and other healthcare facilities. There have been reports that some are threatening to leave the state if this ballot measure passes. And I just wonder what you make of that. What's the word on the street?
Honestly, I think a lot of it is a distraction to confuse people. But the reality is, when you look at any kind of wealth tax that's ever been introduced in many other states, there's always this scare tactic. We're going to lose all the wealthy people in our state. And time again, that never happens. So recently in Massachusetts, they passed a wealth tax, and it's a permanent wealth tax. So it's not even a one-time tax. It's for millionaires, or it's on millionaires. And the whole campaign was, millionaires are going to leave the state. We are going to lose our tax base. Everything we're hearing right now against, our initiative in California. And what ended up happening is they went from like 400 and something millionaires to 600 and something millionaires after this passed. So what they said didn't actually happen. They saw more millionaires move into the state or be made in the state. I just think this whole billionaire flight narrative is, one, a distraction, but two, folks are not going to leave this state where they created their wealth. There's so much innovation here in California. I just think it's trying to distract voters from what we're actually trying to solve here, which is let's save our healthcare system in California.
It's kind of an absurd notion. I mean, no one moves to California because of tax cuts. They move
Yeah.
to California because it's California, right? So
Yeah.
like going to New York or moving there because you like the pizza. That's not why you move to New York.
Exactly.
But there's another stat that I want to throw out for people. Billionaire political donations, they typically skew Republican, right? And I don't know what that is per state, but just generally, just overall, they skew Republican. But the thing that I like about this billionaire tax cut is that ballot measures are typically people driven, right? They're driven by the little people, I guess. And I think that's one way to kind of balance things out and give power back to the citizens.
Yeah. I mean, this initiative itself, I work at SEIU-UHW. We represent 120 healthcare workers, 120,000 healthcare workers across California. And so this is janitors at hospitals. This is nurses at hospitals. These are, your pharmacy techs, the folks that help you in surgery, your surgery techs. Our members, the healthcare workers of UHW decided, this is such a problem. We are going to put our resources towards qualifying this initiative, putting this out, actually creating a solution, because everybody agrees we are heading towards this collapse. Everybody agrees on what the cuts that are coming to California are, but nobody is putting forth a solution. And so healthcare workers across California said, let's resource this. Let's put this on the ballot. Let's let voters decide. And all of our internal polling shows that this is incredibly popular. It's popular with independents, very popular with Democrats, and even there's like some strong support amongst Republicans. So that tells me this is not a partisan issue. People understand that we can't be without healthcare, and they're going to support something like this. So I think it's, we appreciate ballot measures because it does put the power back into people's hands. And in this case, healthcare workers are leading on driving a solution to one of the biggest problems we're going to have in our budget in the next few years.
Yeah. One of the things that I've learned about ballot measures over the past few years is that they have been an effective tool to fight back against overreach, federal overreach, right? Yeah. States have used ballot measures to protect abortion access, to pass minimum wage. Can't remember what state passed minimum wage through a ballot measure. They protect voting access. And so, like you said at the beginning, this is the first of its kind. Do you see this as a roadmap for other states to protect their healthcare access?
I think the ballot measure itself is such a great tool to solve for any problem, including problems that legislatures or governors or whatever government, sometimes it's done at the local level. They're a great tool to solve for problems that sometimes our elected officials either won't, can't, whatever the reasons why. So I do think it's a great option for others to look at, particularly when we're looking at such huge cuts across the country when it comes to healthcare. Like, we're not the only state that's in this situation where we're going to see devastating effects.
So what's the timeline of this ballot measure? You're gathering signatures right now. So what can we look for in the next few months?
Yeah, so we are collecting signatures. It's going very well. We've just trained like 700 of our healthcare workers across the state to collect. We're going to collect through about mid-spring when we have to turn them all in. We have to collect just over 875,000 signatures. Then in the summer, around June, we'll officially qualify for the ballot. And then it's the sprint to November to get this passed. So throughout that time, we're working on building our coalition. We have Senator Sanders, who has come out in support. The Teamsters, the California Teamsters, just announced their support earlier this week. And so really, while we're qualifying this measure, we're building our coalition. We're raising the money we're going to need to go up against very well-financed opponents. But we think in the long run, Californians are going to understand the absolute necessity to protect our healthcare and safety net here in California.
Excellent. So even though it is really popular and you're getting lots of support for it, what happens in case it does not pass? What does the healthcare landscape look like for Californians if this does not pass?
Yeah. Honestly, it's very scary, and it's very scary for everyone. We think about seniors and veterans, and particularly seniors when we think about a lot of the healthcare they rely on. Most of it is funded by Medi-Cal, or a Medicaid program here in California. So like nursing home services, home care services, many of our seniors and disabled folks, they rely on those kind of healthcare services that are primarily funded by Medi-Cal. When we think about the children in California, so a third of California, or actually 40% of California children they have Medi-Cal. Almost 50% of the births in California are funded by or paid for through Medi-Cal. So just these cuts are so devastating. Folks are no longer going to have access to that care. But also just to think about some of our small businesses across California, not owned by Billionaire. I'm talking about like the boutique shop down the street or the mom and pop general store. Many of them who try to provide healthcare for their own employees, like they're starting to see their bills for premiums go even higher because now all those costs are being shifted to folks that are paying for health insurance. So I just think like, what's gotten a lot of attention is the poor billionaires, but what hasn't gotten the attention is, what's going to happen to Californians that don't have access to healthcare. And I even failed to mention our community clinics who are primarily funded by Medi-Cal. And we're talking about clinics that are in LA and Oakland, all across in most of our like urban parts of the state, but even in our rural parts of the state. I could keep going and going about all of the cuts, but it's just, that's how prevalent or that's how much Medicaid funds in our state. And that's really what this is all about, is how do we make sure that doesn't happen and that we have the funds to actually keep these services open and available for Californians.
I would imagine there's also an impact to maternal care, right? Maternal mortality, right?
Absolutely. And especially if we already think about, women of color, specifically Black women who already have a hard time, not just accessing care, but when they do get care, it's not the best care. And they have the highest rate of honestly dying when they're just giving birth. Mm-hmm. And so when you're already in a system that needs more funding and then you're cutting it, like I can't even imagine what that's going to look like. I don't even have a stat to share with you because we know it's going to impact that.
So I am not in California. And if you're not in California, what can you do to, put the spotlight on this bill or to help this get through?
Yeah. So I'm glad you asked. So folks can visit our website. It is cabillionairetax.org. You can contribute to the campaign because we definitely need to fundraise lots of money to make sure that this gets passed. If you're in California or if you have family in California, friends, encourage them to sign a petition. We have folks all across the state at your local grocery store. I'm sure you will see someone with a petition, but also just sign up for our mailing list. We have some exciting stuff that is coming up that we hope to get folks not just in California involved with, but folks outside of the state as well.
So I'll put links to that in the show notes to make sure people can know where to sign up. So that's really great. Well, Suzanne Jimenez, thank you so much for joining me. And thank you so much for your work on this. Hopefully this can get over the finish line.
Yeah, thank you so much, Jen, for having us and having me here. It's some exciting work that's coming ahead.